Good evening, I'm Andrew Chang.
And I'm Adrienne Arsenault. Tonight, with cases up, Atlantic Canada deflates its bubble.
I've said before that COVID-19 is knocking at our door.
Why the change of course?
Is it time for Alberta to make a move?
This is like a snowball rolling down a hill.
Plus, why the latest vaccine seems so promising.
A truly global vaccine in terms of its deployability and its accessibility.
And one-on-one with Dr. Theresa Tam.
Keep to your current household contacts as much as possible.
Her prescription for the hard winter ahead. This is The National.
For months, the Atlantic bubble has been a Canadian COVID success story. The virus controlled well enough to allow people unrestricted travel among the 4 Atlantic provinces.
But today, that changed. The bubble burst. The virus has been spreading in parts of the region and case counts growing. So today, 2 provinces announced new travel restrictions and all of them reported new COVID cases, pushing their total active cases higher. New Brunswick topping the list with 89.
Looked at from just about anywhere else in the country, those numbers may seem almost enviable, but there is a hidden problem: community spread and a fear that the case count could explode. Kayla Hounsell takes us through it all.
Ivan Chan runs a small family restaurant in Halifax. Even though government regulations don't require it, he's decided to close his dining room and offer takeout only.
I get a little nervous, I would say, with all those cases and exposure locations that you see in the news every day.
Today, Newfoundland and Labrador and Prince Edward Island decided they're getting nervous too, pulling out of the Atlantic bubble at least for 2 weeks.
I've said before that COVID-19 is knocking at our door, and in recent days, that knocking has become louder and stronger.
Since July, Atlantic Canadians have been able to travel within the region without isolating for 14 days, as is required for the rest of Canada. The low case count had become a source of pride. Today, Newfoundland and Labrador says leaving the bubble is a preventative measure to avoid a full lockdown.
For weeks now, we have watched as the second wave of COVID-19 has gained traction and built momentum across the mainland. It felt like it was just a matter of time before it made its way east, and it has.
In Nova Scotia, health officials now say there is community spread. New Brunswick announced another death today. But both provinces are technically still in the bubble, or what's left of it. Islanders can visit those provinces, but they'll still have to isolate when they return home.
I'm sad. I'm from Nova Scotia, so if it stays burst, then I won't be able to go home for Christmas.
I think it's probably for the best at the moment to just stick to where we are, just to keep everyone safer across the bubble, and maybe in the future we can go back to the way we were.
Governments say they'll reassess the bubble's viability in 2 weeks.
As soon as everybody is doing their part, like we have been in Nova Scotia, I really think we can, this time would be passed.
Chan hopes his temporary sacrifice will help get things back under control.
So Kayla, I guess bottom line, does this mean that the bubble failed?
It's an interesting question, Adrienne. I mean, the Atlantic region has been the envy of the rest of Canada and beyond. We've reported on people who want to move here, and it has been working. I mean, for more than 4 months now, other than wearing masks, for many here, life has been pretty normal. But I think it's important to remember that officials have always said it might not work forever and that they wouldn't be able to keep the virus out completely. Adrienne.
All right, hang in. Kayla Hounsell in Halifax. Thanks, Kayla.
Now, joining us from Halifax is infectious diseases specialist Dr. Lisa Barrett. And Dr. Barrett, for anyone not living in Atlantic Canada, the numbers will seem quite small, right? P.E.I. in single digits, Newfoundland and Labrador in the dozens. I get that the populations are smaller, but what is the primary concern here?
Obviously, New Brunswick and Nova Scotia have higher numbers, and P.E.I. and Newfoundland are well aware that asymptomatic spread is a big deal. They do not want to bring more cases into their province because that's how you start to have uncontrolled spread when you have such low numbers. And they've decided to take a very aggressive action to keep things closed for a little while, which is a great leadership move, especially from a virologic and infectious disease perspective.
Okay, but then why wouldn't Nova Scotia and New Brunswick sort of sever their connections? Why not? Why keep that bubble intact?
We have similar numbers in New Brunswick and Nova Scotia. We're very connected in a workforce and border perspective. And so really the answer in our populations is to make sure that we're testing more so we know where people are and when they're positive so we can help them to isolate when they need to. Better than closing our bubbles to each other is to make sure that we know who's positive with additional testing.
Okay, that's helpful. Dr. Barrett, thank you so much.
Thank you.
So that's some drastic action in Atlantic Canada after a week of, on average, about 20 cases a day across the entire region. Alberta, meanwhile, is facing outbreaks on an entirely different scale. Today, 1,549 new cases. That is almost exactly the same as Ontario's number, and Alberta has 1/3 of Ontario's population. Looking at this per capita, Alberta is chasing Manitoba for the highest provincial rate of daily new cases. That is not a race you want to win. And hospitalizations, which typically lag new cases by weeks, have already more than doubled this month. Carolyn Dunn is tracking that province's coronavirus response, which so far has involved resisting restrictions seen elsewhere in Canada.
Gift shop owner Tara Chakowski is expecting some sort of COVID restrictions to be announced tomorrow. She's making contingency plans for whatever happens, but wishes it had come earlier.
Small businesses, retail businesses, we rely on this revenue from December, and closing us down is going to hurt.
Alberta's test positivity rate is 8%, suggesting a lot of cases are going undetected. An even larger surge of hospitalizations and ICU admissions are inevitable at this point, according to Alberta's top doctor.
This is like a snowball rolling down a hill, growing bigger and faster, and it will continue unless we implement strong measures to stop.
Doctors are warning the impacts are already being felt well beyond COVID units.
Hip surgeries are being cancelled. There are longer waits for medical imaging, which can delay a cancer diagnosis. Entire clinics are being cancelled because the doctor or the nurse who's working is sick or in isolation and can't attend.
The anger and despair on display at Health Minister Tyler Shandro's district office shows how much public pressure Alberta's cabinet faces as they decide what restrictions to mandate. And that political pressure is pulling both ways. A new poll released today shows while 81% of Albertans surveyed support a province-wide mask mandate, only 61% would approve a 14 to 28-day lockdown of non-essential businesses. Those against restrictions are vocal and, according to that poll, overwhelmingly conservative, part of a political base that has been pushing for few, if any, restrictions. But with growing impacts on the healthcare system, some kind of restrictions are coming to Alberta. The only question? How far will they go? Carolyn Dunn, CBC News, Calgary.
Now, Manitoba could use some good news right now on the COVID front, but today it did not get it. Instead, a record 543 new cases. That's more than double the previous days, and it is unsustainable, according to the province's top doctor.
We can't expect the number of cases we're seeing right now and the number of deaths we have to report every day as our norm. We have to do better.
Manitoba recently enacted strict lockdown measures, and case rates have started to level off in recent days, but today bucks that trend.
And there was a record-breaking day in Ontario, too, unfortunately. 1,589 new cases. That's the highest daily count yet. And the province's third straight day of reporting more than 1,500 new COVID infections. So 2 of the province's hotspots went back into lockdown today, Toronto and neighboring P.E.I region. That is Mississauga, Brampton, and Caledon. As Jacqueline Hansen tells us, the timing could not be worse for small businesses.
At this Toronto board game shop, the holiday shopping season could have been a saving grace.
If back in March you'd told me, hey, pick 1 month you're allowed to be open this year and be closed the other 11, it would be from now until January 1st.
Instead, the small retailer is considered non-essential and forced to stop in-store sales, while big box stores that sell similar games but also essential items such as groceries are allowed to stay open.
Shifting traffic to Amazon and to the big box stores. It makes no sense.
Independent businesses are calling on Ontario to allow small retailers to open with limited capacity, 3 customers and 3 employees. Otherwise,
Doug Ford, unfortunately, has signed the death warrant of thousands and thousands of businesses who will just not be able to survive.
But the Premier hasn't budged, pointing to the new federal rent relief program, wage subsidy, other support for small businesses' fixed costs, and consumers for help.
Continue supporting small businesses, order off them, opposed to the big folks online, because the big guys are going to survive, and we just have to protect the little guys right now.
The physical size of some stores is part of the province's health concerns.
In smaller rooms, smaller spaces where they're more crowded, where perhaps the ventilation isn't as good as it could be.
But the owner of this small essential oil store argues her size is her strength.
We have more control and we pivot far faster than anybody else.
And she says making sure sales are done safely is everything.
The store is the only thing we have as an opportunity, to connect with customers and to people and to sell and to pay my bills.
She fears that if the lockdown doesn't help, her store could stay closed into the new year. Jacqueline Hansen, CBC News, Toronto.
So let's have a look at the situation in Saskatchewan. Officials added 235 new cases today, and the Premier is in self-isolation after a potential exposure at a restaurant. Scott Moe was tested today, is not experiencing any symptoms. The government says he will work remotely.
Now, there was a promising development today about another vaccine trial. It comes from British drug maker AstraZeneca, working with the University of Oxford, and it's one of several vaccines Canada has pre-ordered. But Renee Filipponi looks at what makes this one special.
We're here just to give you a briefing.
A major step forward for a British-made vaccine got a royal welcome today from the Duke of Cambridge.
It's an amazing achievement, isn't it? It really is.
The Oxford AstraZeneca vaccine, now the third to show encouraging results, was given to more than 20,000 people in the UK and Brazil. The trial tested 2 dosing regimes and had an average efficacy rate of 70%. But the results for each group were very different. One group got 2 full doses 1 month apart and was 62% effective. The other got half the dose for the first shot, followed by a full dose 1 month later. It was 90% effective. Scientists don't fully know why the half dose worked better.
We also, in the trials, saw no one go into hospital with disease or develop severe disease if they had been vaccinated.
Right then, so I've got over here COV-020.
The vaccine needs to be approved by regulators around the world. The UK government says it could start offering it as early as next month.
We can take great heart from today's news, which has the makings of a wonderful British scientific achievement.
Unlike the Pfizer and Moderna vaccines, which have shown a higher efficacy rate, the Oxford vaccine is much cheaper and easier to store and transport.
I think this will be a truly global vaccine in terms of its deployability and its accessibility. And it's going to be probably more affordable than most others for low and middle income countries.
AstraZeneca says it can provide 3 billion doses in the next year and pledges not to make a profit from poorer countries. The fight against COVID is far from over, but this is a glimmer of hope during a dark time for countries around the world. Renee Filipponi, CBC News, London.
Now, the health minister was asked today about a plan to get a vaccine out to Canadians.
All of our departments are working right now, round the clock actually, on making sure that we have a concrete plan with the provinces and territories, that we are ready to deploy the vaccines as soon as they arrive on Canadian soil.
The minister says all 3 leading vaccine candidates have submitted to Health Canada for rolling regulatory review, which should speed up the approval process. Okay, now I'm joined by infectious diseases specialist Dr. Zain Chagla, because I'm wondering if you can help me understand how the AstraZeneca vaccine might fit into a Canadian rollout, starting with that bit about it being cheaper and easier to store. Why is that the case?
So it's important to note the difference between this and the other vaccines. The other vaccines used mRNA, which is kind of part of the genetic compound. It's very tricky to deal with. It has to be stored at a particular temperature to make it stable, and it's hard to work up in the lab. So that's really where that requirement for refrigeration comes from for the Pfizer and Moderna vaccine. This is based on a virus, so it's using a separate virus to essentially mimic COVID-19. And so it's much easier to grow viruses in the lab. It's much easier to store viruses in the lab. And that really gives that refrigeration component that makes it so friendly.
Right. And so knowing how fundamentally different it is, how would all of that affect who in Canada might get this particular vaccine and who might get the Pfizer and the Moderna ones?
Yeah, I mean, I think number one is that, the remote communities, places that are hard to reach, places where 6 months of shelf life is going to be important, that this vaccine certainly has a big role. And the other part is, as we're studying these vaccines, we may find that one works well in certain populations and not in others, or one works well after getting a particular vaccine or getting natural COVID infection. I think that data will come out as there's more real life experience with these vaccines.
Right. Very interesting stuff. Dr. Chagla, thank you so much.
No problem.
The federal government has launched its new rent help subsidy today.
Businesses subject to a lockdown restriction will be able to get up to 90% of their rent covered.
And unlike the previous program that required landlords to apply, this money will be paid directly to businesses starting December the 4th. The subsidy is retroactive to September 27th. It's expected to run until next summer. And next Monday, we can expect to hear just how much Ottawa has spent on the pandemic. Chrystia Freeland's going to deliver an update on federal finances, including the deficit. In July, it was estimated to be heading towards a record $343 billion. Well,
tens of thousands of Canadians say they've caught COVID-19 while at work. Now, a CBC News investigation looks at thousands of workers' compensation claims. Dave Seglins has the details.
It's a long road to recovery for Jeffrey Friedman. He was a picture of health in late March, but he says he contracted COVID a week or two later at work, landing him in the ICU.
I have brain fog. I have permanent damage to my vocal cords from the ICU and tubing for 33 days.
His work supplying materials for Toronto's booming construction industry was deemed essential, and he felt he had no choice.
I was in a bind, but because we needed the money, I kept going and going and going.
CBC News contacted workers' compensation boards across the country. We found that more than 26,000 workers have filed claims that they got COVID-19 at work.
That doesn't even count workplaces where workers might be discouraged from making a claim, or workplaces where people might not know that that workers' compensation exists and is available to them for this kind of illness.
And the numbers don't capture workplace COVID cases in provinces like Ontario, where not all workers are covered, even some frontline workers.
It really highlights the absurdity of having a compensation system that just cuts out whole swaths of industries and says you're not entitled to coverage.
Jeffrey Friedman's claim was approved, along with 20,000 others across the country. It's financial help, but also help at home.
They retrofitted the shower with a telephone shower and gave us the shower seat, so that I can shower him
because I can't stand long.
Yeah.
But on Friday they heard from workers' compensation. Jeffrey's employer is appealing, arguing there's no proof he got sick at work.
How do you feel about that?
Scared.
Appeals aren't uncommon. Successful claims can drive up an employer's premiums, but it leaves Jeffrey Friedman now with two battles: recovering from COVID and fighting his bosses over whether he actually got sick at work. Dave Seglin, CBC News, Toronto.
Well, tonight, a checkup with Canada's top doctor. Where did things go wrong? Ahead on The National, Dr. Theresa Tam's holiday message to Canadians.
And we return to pandemic ground zero, why life in Wuhan is far from normal.
But first, a sign of cooperation tonight from Donald Trump.
America's back.
Biden's transition begins. We're back in 2. Welcome back. China launched a lunar mission today. The mission is to collect and return samples from the moon for the first time in more than 40 years. If successful, it should be returning to Earth sometime in mid-December. China's space program aims to have a human colony on the moon by the 2030s. Hong Kong pro-democracy activist Joshua Wong and 2 fellow campaigners are facing the prospect of prison after pleading guilty to charges of organizing and inciting part of last year's anti-government protests. The 3 were taken into custody today and could face up to 5 years behind bars. They're expected to be sentenced next month.
Donald Trump came the closest he has yet to admitting he lost the U.S. election. Not quite, though. But as Susan Ormerson tells us, the authority in charge of transitions has given Joe Biden the green light. And Trump says he has told his team to cooperate.
16 days after the election was called, Joe Biden finally gets the green light to proceed. The General Services Administrator tonight declaring he is the apparent winner, which formalizes the transition. Biden's incoming and Trump's outgoing teams will now coordinate to turn over power. Giving into the obvious, Trump tweeted, "Do what needs to be done, but our case strongly continues and I believe we'll prevail." Close to acknowledging he's lost, sort of, as Biden begins to shape his cabinet.
America's back. We're going to be back in the game. It's not American alone.
He's choosing trusted personal allies.
To introduce a man who has been my mentor, my partner, my friend.
Antony Blinken as Secretary of State, one of several Obama-era deputies, and some firsts. If confirmed, the first woman to head up national intelligence, the first Latino to lead Homeland Security, and expected to be named the first woman to head up Treasury.
The practical things are what we have to deal with.
Biden with Kamala Harris is looking for experience over chaos. John Kerry will be key as special envoy for climate, telegraphing how much Biden intends to elevate environmental issues inside this White House. It is clearer tonight that President Trump is running out of ramp. Georgia will count its votes for a 3rd time tomorrow, but Michigan certified for Biden today. And now he will get those security and pandemic briefings, which had been delayed for weeks. Susan Ormerson, CBC News, Washington.
Following the death of longtime host Alex Trebek earlier this month, Jeopardy says it will start production next week with a new interim host. Jeopardy record holder Ken Jennings will be the first in a series of guest hosts when new episodes air in the new year. He claimed the show's greatest of all time title in a competition last year. The show is still running episodes that Trebek filmed before his death. His final week of shows will air starting Monday, January 4th.
Very interesting choice. Okay, next on The National, one-on-one with Canada's top doctor. I got to ask you about Christmas. I mean, you've got to be worried about the holiday season coming up, right? Dr. Theresa Tam on how we got here and her message to Canadians about what has to happen next.
And later, we're back on the ground in Wuhan, China, the lasting scars months after it became the epicenter of a pandemic.
Well, on a day of record high numbers and the collapse of the Atlantic bubble, it's a good time to talk with Canada's Chief Public Health Officer. If the pandemic is a war, Dr. Theresa Tam is our top general. We spoke earlier today about everything from how we got here to what we need to do for the holidays. Her answers are frank, but not without hope.
Listen, right here.
I'm just doing a little test here. 1, 2. Hi, Dr. Tam. This is Andrew. That's the million-dollar question. All right, well, Dr. Tam, very good of you to make the time to talk to us. I really appreciate that.
It's my pleasure to talk to you.
So let's talk about the fact that we are seeing pretty alarming case numbers across the country, and I'm sure on a personal level they're deeply disturbing to you as well. My question is, in your mind, I mean, broadly speaking, where did things go wrong?
Well, I think at the beginning of the pandemic, with the initial wave, I think we actually knew much less about the virus, but there was a incredible collaboration across the whole of society in Canada in flattening that initial wave. Of course, over the summer months, some of those more restrictive measures, and rightly so, were relaxed a bit more. With the, the force coming, looming ahead, with some of the increased interactions in society and more spread in certain situations, the cases unfortunately accelerated.
Right. So help me understand then the weak link as you see it in all of this, because I can't help but wondering, was it a policy rules issue? Was it a behavioral issue, which is I think what you're in part alluding to, or is it a logistical thing, a contact tracing, a testing issue? What is the source of your greatest concern that has led us to where we are today?
Well, I think it's a matter of all of those components coming together. So I think with the provincial territorial medical officers of health, they were really trying very hard to achieve a balance where they could keep up with the test, trace, and contact, as well as keeping society open. That balance, nobody knows exactly how that balance was going to be achieved. So they were trying very hard to provide that balance, really, really hard, until that balance, I think, tilted towards the acceleration in the cases faster than their system was able to manage them. And hence, we need both the public health system strengthening, but also the public to help in these instances to drive and flatten that curve down again.
So then let me ask you this. I mean, the fact that we are seeing much more severe restrictions come into effect, right across the country. What happens after that? I mean, do you have faith that the case counts don't simply slingshot back up after the lockdown eases? I mean, how do we stop riding the roller coaster?
That's a very important point. So during this period where greater restrictive measures are being put in place by the provinces and territories, this is the time to really ensure that if plans need to be shifted, they have to be, or strengthened, they have to do it during this time. There's need to, again, strengthen the testing capacity. There's enough, we keep putting out tests. How do they get deployed? And what kind of additional contact tracing and other capacities are needed? And of course, the federal government is there to support them. But you can't just take your foot off the brake pedal without additional capacity being built. Because if you did, as I said, the immunity level in the population is still low. So then the inevitable thing that's going to occur is that the cases will rise again.
Right, but I got to ask you about Christmas. I mean, you've got to be worried about the holiday season coming up, right? I mean, has it ever been a serious consideration for you to just, I don't know, explicitly tell Canadians, you know what, don't gather, don't do it, it's not worth it?
Well, I think we are essentially at that point where the communication is that Christmas is not going to be having any kind of large group interactions for sure. Even with family, you got to really think twice, avoid non-essential travel, keep to your current household contacts as much as possible. But we know if Canadians do decide to have a small gathering, still observe all the different public health measures. Not everywhere in Canada is the same, but really right now, if I looked across the country, that message probably should resonate throughout all provinces and territories.
I have to squeeze one more question in for you. Obviously, the vaccine, in whatever form it comes, is a source of great optimism for a lot of people. What else is there that makes you optimistic beyond that?
Well, there are many things. So, as you said, the vaccine is one of them. Increasingly, even in the last months, much has been learned about how to treat and take care of patients with COVID. So that's really important. There will be more treatments that we can consider as well. We will always see the end of a pandemic. No pandemic doesn't have an ending. And I think, again, we need to sort of stick together as a population, as a country, in order to just get through it. And so this is just a period of time where we have to maintain these measures.
Dr. Tam, I thank you warmly for your time, and I hope we get the chance to talk again soon. Thank you so much.
Thank you.
So as someone who's always looking for something optimistic, I'm kind of like hanging on to those words of hers, but there's a but there.
Yeah, of course. And I mean, you know, when it comes to the findings of all three of the sort of promising vaccine trials that we've heard of, so Pfizer, Moderna, and AstraZeneca, I mean, they're all based on interim data for the moment, right? So that's the big asterisk. There's also the fact that we are heading into winter, where you see increasingly people huddle indoors, where we also typically see seasonal viruses start to spread their wings. So she's really, yeah, and you heard her hit that point a few times, that people really need to willingly reduce their social contacts, right?
Okay.
Yeah.
Easier said than done.
And I should say, we are going to hear more from Canada's top doctor on Wednesday night. Dr. Tam speaks with Joanna Remiliotis about a looming public health challenge, namely vaccine hesitancy. It's a big one.
And next on The National, we head back to where it all began, Wuhan, China, where the coronavirus was first detected, what scars remain, and the lessons learned months after the world watched it go into lockdown. Welcome back. In China, a new round of mass testing is underway for the coronavirus after new cases of community spread were detected. The fear and the government's heavy-handed response harken back to the beginning of this pandemic, when the city of Wuhan went into lockdown. Sasha Petrusek recently traveled back there to see what's changed.
Wuhan's garment district is abuzz. Carts jostle and deals are made. Stores are stocked. Meals are served. At first glance here, COVID has been conquered. Living and making a living seems easy again. But venture into the back lanes where seamstresses work for a few dollars a day, and you'll see the stitching is a little slower, the customers fewer. Too many of the stores Hu Wei-yong rents out sit empty. Since the lockdown, he says, Wuhan seems like a dead city to me. It's like we pressed the pause button. We're very afraid, still living in the shadow of COVID. The scars of this scare are never far from the surface. Making money doesn't seem as important anymore, says Lu Lihua. Just living is the priority. This central Chinese city was the first to feel the full consequences of COVID after the virus was discovered here in January. A metropolis of more than 10 million on the Yangtze River, shut down and cut off from the world in a matter of hours. Many in Wuhan look back on the lockdown as a nightmare, though now few dare criticize it publicly. There are stories of people feeling imprisoned in their own homes, sometimes quite literally, with the doors welded shut. They talk about shortages of food and medical care and a serious lack of reliable information. As the rest of China was preparing to celebrate Lunar New Year, the orders to lock down came from Beijing. 加油, Wuhan! 加油, 中国! Within hours, people were ordered into their homes. Police rounded up residents suspected to be sick. At the time, it all seemed so draconian, the kind of thing only a dictatorship like China might do. But there was reason to panic. The deadly virus, apparently spreading from stalls at the city's seafood market, was taking its toll. Bodies were collected from apartments all over the city. A grim count of corpses piled up outside Wuhan's hospitals. Inside, there was plenty of grief at the bedside. My father, he says, he's gone. He stopped breathing. Hospitals were in disarray, patients parked in hallways, shortages of doctors, beds, and equipment. It didn't have to be quite so frantic. As early as December, 1 month before, A Wuhan doctor alerted his colleagues to a strange new disease infecting patients. But Dr. Li Wenliang was silenced by police. He later died from COVID, becoming a popular hero as whistleblower. Today, Wuhan's seafood market, considered by many as ground zero for this pandemic, is closed, decorated outside, abandoned on the inside. But around here, none of it is forgotten, certainly not by Dr. Yu Chengping, who was on the front lines as COVID spread and ended up being the first doctor infected in January. COVID wiped him out for 3.5 months, he says in a rare interview with Western media. I was very weak after I got sick, he says. It was life-threatening. I lost some 15 kilograms, and even now, I have trouble breathing. But as a doctor, I learned a lot. He says the Chinese government didn't recognize the seriousness of the problem at first because the number of infections seemed low. But he says once it did, Beijing did the right thing with a strict lockdown. That's why it's so difficult for other countries to control the virus, he says. Isolation is so important, yet people elsewhere insist on freedom. So while North America and Europe struggle with a deluge of COVID cases, officially there hasn't been a single locally transmitted case here in months. Nothing to distract from lazy afternoons, fishing on the banks of the Yangtze, or busy Saturdays shopping downtown. Still, the human cost remains high for Xi Shuli and her husband. A musician she can only watch perform on her phone now. Back in January, right as Wuhan's lockdown was starting, he collapsed at home with a high fever. She went from hospital to hospital trying to get him admitted, finally finding one that wasn't already full. Doctors sent him straight into intensive care, ICU. He had COVID. I'd heard COVID stories. I was so afraid, she says. I was so sad and afraid I would never see him again, she says. I was just left with his clothes. Wuhan is full of sad stories this year. Still, many feel they've survived tough times and even dodged death. They drink to continued health and even to Wuhan's nightmare lockdown, which many think the world needs to emulate.
So, Sasha, almost a year later, very few cases. Given what's happening around the world, is there a worry about yet another wave there?
Well, Adrian, people are afraid of this virus. They've gone through all of this. But because of that, there are a lot of people who also have this strange sense of immunity, that Wuhan is okay if they can only keep COVID out. And China has put up some pretty big barriers for people to come in. It's very difficult to come into the country right now. If an infection is discovered, they have a very intensive system of tracing. That's true in every city in the country. And they also do massive testing. They went through that in Wuhan itself back in May for the last time, but not since.
Okay, Sasha Petrusik in Beijing tonight. Thank you, Sasha.
My pleasure.
And next, a Saskatchewan woman says she was punished for receiving the CERB.
They're saying that I'm $2,400 behind on rent.
why she was blindsided by what happened after she received the emergency money she desperately needed.
I'm Jamie Poisson, and tomorrow on CBC's Daily News podcast Front Burner, as Alberta hits the highest daily COVID numbers in the country, a hashtag takes off with people asking, where's Premier Jason Kenney? Subscribe wherever you get your podcasts.
Some on social assistance who got the Canada Emergency Response Benefit, or CERB, say they've been punished for it. That's because some provinces either clawed back some of their benefits or more. Bonnie Allen hears from a Saskatchewan woman who was completely cut off.
They're saying that I'm $2,400 behind on rent.
Dory Arnold just got evicted by her landlord. She's locked out and homeless. In the past, Arnold has always been able to make rent using social assistance and disability benefits from the province. But then in July,
we were at Timmy's one day and some lady came up to my mom and asked if we were collecting the COVID money. And we're like, no, we never heard of it. She said it's free money that's given to the low-income families to survive while the COVID's out.
At the time, Arnold's apartment was infested with cockroaches and she needed new furniture.
One phone call and give your social insurance and then boom, you get $2,000. Is that how easy it was? That's how easy it was.
She says no one explained the criteria or the consequences. The province cut her off social assistance. The Saskatchewan government says the CERB was a wage replacement program and provincial income assistance benefits are reduced dollar for dollar from the amount a person received from CERB. The federal minister in charge of the CERB maintains it's unfair for provinces to penalize the most vulnerable, that the CERB was supposed to complement provincial supports.
It ended up really being a federal transfer to the province where they made a savings on the CERB monies as opposed to it being a real benefit for people on provincial income assistance programs who really needed it.
This anti-poverty advocate points out it didn't actually cost Saskatchewan anything to have people get money from Ottawa.
So we do see this as the province saving money on the backs of the poorest people in the province.
Landlords then have no rental income for those few months and ultimately are forced to evict those tenants.
The Saskatchewan Landlord Association is also assigning blame to the province for creating a systemic problem.
It puts us in a very morally tough spot.
And it's just start getting more difficult.
And now Dory Arnold is broke, crashing at her mother's house.
I'm sorry.
She'll be able to reapply for provincial assistance, but for others, they'll have to deal with money being clawed back for months. Bonnie Allen, CBC News, Regina.
Next on The National, a surprise from a stranger. In the form of, butter. The story behind this next in our moment. Julianne Bousquet from Maine kind of loves Canadian butter, specifically a brand of butter only sold on Prince Edward Island. And normally she would just go there and stock up. So this year, Julianne couldn't do that. But of course, there's a twist, a surprise from a stranger, and that's our moment.
My wife and I go to Prince Edward Island. We always bring back about a case of ADL butter because we love it. We couldn't go to Prince Edward Island this year.
I saw a Facebook post it's called We Love Prince Edward Island. You know, she really missed the island, was not able to go this summer because of COVID. She was really missing her ADL butter. And I thought I can probably send her a couple of butters.
In the mail comes a box from Nova Scotia. And inside that box was 2 pounds of ADL butter. The kindness of the act just overwhelmed me. I loved it. There are far more kindness and love and generosity in the world than we ever give it credit for.
Okay, so this is great. So Julianne is a hospice chaplain. Tara, who sent the butter, is a neonatal nurse and says that she sort of felt like a kindred spirit and thought, I'm going to do something for her. And now Julianne is on passing it and sending like Humpty Dumpty chips to someone who can't buy them.
Right, and apparently Julianne's not even done receiving. So another woman apparently is sending her 9 pounds of this butter, which kind of begs the question, what do you do with
baked goods? Like right here.
Yeah, that's not a bad idea. That's The National for this November 23rd. Have a great night.
Good night.